Hi everyone, and welcome to my channel. I'm excited to share my content with you, and I hope you enjoy watching. Don't forget to like, comment, and subscribe to stay updated on my latest videos. Let's get started. In this video we are going to see about heart attack signs. 1-minute test. It is important to know the signs of a heart attack, which can be different for different people. People can sometimes have a heart attack and not know it, so they don't get the emergency care they need. That could cause long-term damage to the heart. A heart attack is called a myocardial infarction in medicine, MI. Most of the time, a heart attack happens when a coronary artery gets blocked, cutting off or stopping blood flow to the heart muscle. The most common sign of a heart attack is chest pain, but the other signs can be different for men and women and for people of different ages. It is important to notice a heart attack as soon as possible and get help right away. Treatment can lessen the damage and make it more likely that the person will get better. This article talks about the different signs of a heart attack, how they may be different in women and older people, and when you should go to the hospital. It also talks about risk factors, how to treat it, and how to stop it. How do you know if you're having a heart attack? Most people know that chest pain is one of the main signs of a heart attack. But a heart attack doesn't just hurt the heart. It can affect the whole body. People of different ages and genders may have different heart attack symptoms. According to the Centers for Disease Control and Prevention, CDC, there are a few telltale signs of most heart attacks. They are pain or discomfort in the middle or left side of the chest. This is a common sign of a heart attack. It could hurt more sharply or more like being squeezed, full, or under uncomfortable pressure. Having trouble breathing. This is usually accompanied by chest pain, but shortness of breath can also start before chest pain. Pain or discomfort in the upper body. A person might feel pain or discomfort in one or both arms, which can spread to the shoulders. Pain in the neck, jaw, or back may also happen. Feeling dizzy. Someone may feel weak, pass out, or start to sweat cold. Signs of a heart attack in women. The signs of a heart attack may be different in women, and they may seem less obvious or have nothing to do with heart problems. Here are some common signs of a heart attack in women that can happen with or without chest pain. Sleep disturbances, a sudden loss of strength, extreme shortness of breath, nausea, indigestion, or other digestive problems, pain all over the body, a general feeling of being sick, or pain in the back or upper body. Since chest pain is a common sign of a heart attack, women often misinterpret their symptoms and wait too long to see a doctor. It is important for everyone, but especially women, to know the unusual signs of a heart attack and get medical help right away if needed. Heart attack symptoms in older people. Like women, older people who have heart attacks may have symptoms that are not typical. More heart attacks happen when there are no signs or symptoms. Sources said, in older people, and chest pain isn't something that happens very often. During a silent heart attack, a person might not have any symptoms and feel pretty good, other than being unusually tired or short of breath. They may also show one or more of the signs that women show before they have a heart attack. When should you go to the hospital? The National Heart, Lung, and Blood Institute says that if someone is having a heart attack, moving quickly could save their life. Even if a person isn't sure if they are having a heart attack, they should still go to the hospital right away to limit any damage to the heart. How long does an untreated heart attack last? If you don't get help for a heart attack, the results could be bad. If someone thinks they might be having a heart attack, they should always go to the hospital. If someone has signs of a heart attack for more than 15 minutes, there is a high chance that the heart's muscle cells will be hurt. When symptoms start, a person has less than 90 minutes to get help before damage gets too bad. If the heart doesn't get enough oxygenated blood, it can't work right, which can lead to a heart attack. When a coronary artery is partially or completely blocked, this can happen. Most of the time, coronary heart disease is the cause of clogged coronary arteries. Atherosclerosis is the buildup of fats and cholesterol on the walls of the arteries, which can be caused by coronary heart disease. Over time, the plaques make the arteries narrower, which slows or stops the flow of blood. Several things put people at risk. Some of these are being 65 or older, being a man, or having a history of heart disease in your family. People of African, Mexican, and American Indian descent are more likely to be affected. There are also things that can be changed that make the chance of having a heart attack higher. These things are smoking, drinking too much alcohol, being overweight, not getting enough exercise, having high cholesterol or blood pressure, diabetes, and stress are all things that can cause health problems. People can change, treat, or control the risk factors that can be changed to lower their chances of having a heart attack. Diagnosis and tests. If you think you're having a heart attack, you should go to the hospital right away. A heart attack will be diagnosed by a doctor based on the patient's symptoms, age, overall health, and family history. They will also test for things like electrocardiography, or ECG, is a test that measures the electrical activity of the heart. Imaging tests, like chest X-rays and echocardiograms, are used to look for signs of heart damage in the blood. Coronary angiography to find out where the arteries are blocked. Treatments. If tests show that someone has had a heart attack, doctors may suggest the following. Coronary angioplasty to open up blocked arteries, stent procedure to support an artery with a wire mesh tube, bypass surgery to create new routes for blood to flow around the blockage, implantable devices like a pacemaker to help the heart beat normally, artificial heart valve surgery to replace abnormal or leaky heart valves. A heart attack may also be treated with drugs that thin the blood, break up blood clots, relax the blood vessels, and help relieve pain. Problems. Heart attacks can damage the heart muscle, which can lead to problems like abnormal heart rhythms or arrhythmias. Damage to the heart was so bad that it stopped working. Sudden cardiac arrest due to electrical disturbances. How bad the complications are and how long they last often depend on how badly the heart attack hurt the heart muscle. People can't control all the things that make them more likely to have a heart attack, like their gender, age, and genetics, but changing their habits could help. These things are choosing a healthy diet low in sugar, saturated fats, and sodium, exercising regularly, controlling your blood sugar, and keeping your cholesterol and blood pressure in good shape. Most people who have a heart attack can still live a normal, healthy life afterward. But about 20% of people over 45 will have another heart attack in the 5 years after their first one. Because of this, it is important to live in a way that can help keep heart problems from happening in the future. That's all for today's video. Thank you for watching, and I hope you enjoyed it. If you did, don't forget to like and leave a comment below. Also, make sure to hit the subscribe button to stay updated on my latest videos. Until next time, take care.